tonight we're going to talk about factors that contribute to healthy prenatal care. So I just want to go over a few things that are really important. First and foremost, for the couple that is planning a pregnancy, they should start out first of all with a visit to their doctor and actually have a physical exam and actually talk about the woman's medical history and any risks that possibly could be associated with the pregnancy and her medical history to get clearance from the doctor to make sure that she's fine and she's well enough to endure the 9 months of pregnancy. Then once the conception actually starts and throughout the entire pregnancy, there needs to be proper nutrition. Starting out with prenatal vitamins and a well-balanced diet, which includes your healthy proteins, fruits, vegetables, healthy fats. So it needs to be a very well-balanced diet. But also too, exercise should be encouraged. Usually it's encouraged from the doctor unless there's some sort of physical limit on the exercise. Obviously not too much strenuous exercise, but if you've been exercising regularly throughout your lifetime, then it's good to continue that during your pregnancy to continue with your health. So do your exercise, but obviously with caution. Also, your vitamins, your minerals, but malnutrition and poor nutrition is dangerous to a fetus and could actually end up stunting the child's growth. Also, something to consider is caffeine. I know a lot of us have a hard time not having caffeine, so that's another factor that we have to think about and consider. Our coffees, our teas, even chocolate has caffeine in it. So that needs to be limited to slim to none, basically, but also even your sodas need to be caffeine free. So caffeine is a stimulant, so therefore it's not good for a fetus. Another thing that is not good for a fetus is substance abuse. So if you are a smoker, it's something that you're going to have to give up for the next 9 months, and honestly you should give it up anyway for your own health. But that needs to be something that you have to take into consideration before you even think about pregnancy. Any drug use obviously is a factor, and alcohol abuse. Those are things that are not going to be able to continue during your pregnancy. Think about even taking aspirin or prescription drugs that you typically take is something that you need to discuss with your doctor, because medications should be limited and very much screened by your doctor to make sure that you can even be taking them during your pregnancy. They can be very harmful. So again, this is why all of these items need to be discussed with your doctor. Illness and disease is very critical to prenatal care. So if you are exposed to serious disease like the measles or the mumps or even chickenpox, for somebody who's never had chickenpox, it could be death. It could be fatal and cause death. So think about limiting your exposure to anyone that might possibly have those things. Even if you came down with the flu, it could be potentially harmful for yourself, but also for your unborn baby. Also, AIDS, something that is a factor, and that needs to be discussed with the doctor as well, because if you have that could be genetically passed on to your unborn fetus, and that could cause major problems for the unborn child. And then we need to think about environmental factors, things like unsafe drinking water, poor sanitation, and you think, oh, that's not me, that's for, poverty-ridden families in, underdeveloped countries. But even exposure to harsh chemicals, think about your work environment. Where do you work? Are you exposed to toxins in the air, toxins in the chemicals that maybe could be in contact with your skin that could actually reach the fetus of this wonderful baby? So you need to be thinking about that. X-rays, very common practice to get X-rays. So that's something that you need to think about and limit the exposure to that as well. So there's many factors that need to be avoided. There's many factors that need to be highly encouraged, and this is all for taking care of your fetus and making sure that you get a healthy baby in the end. So I hope that this was helpful to you. So just remember, it's proper planning, proper nutrition, no substance abuse, no illness, no disease, and also taking into consideration any environmental factors that you could be exposed to. So hopefully this was helpful to you, and hopefully you learned a little bit of something tonight. So thank you for watching.